Baseball, America's pastime. Each year, 16 million kids throw the ball, swing the bat, and catch a fly. Just like in the big leagues, the pitcher is a big part of the success of the team. When a pitcher throws a baseball, it involves his whole body, not just the arm. The hand grips the ball, the body weight shifts to the back foot, the arm cocks back, the front leg strides forward, the arm accelerates forward, rotating at the shoulder. The weight transfers to the front leg, hips turn to the plate, and the hand releases the ball. All that happens in less than 1 second. Of the 16 million kids that play ball, 50% of those that pitch have some sort of injury each year. Dr. Carl Nissen of Connecticut Children's Medical Center's Elite Sports Medicine program has seen this firsthand.
The incidence of injuries to shoulder and elbows, especially of young pitchers, is rising dramatically. In one particular month, I saw a series of 3 young pitchers, all who required surgery to their elbow, and all who had had pain and discomfort in their elbow the season prior.
There had to be a reason why he was seeing an epidemic of elbow injuries that required surgery when 10 years ago he had seen none.
The main injury to the elbow is the Tommy John ligament rupture or the ulnar collateral ligament rupture. There is also injuries to the shoulder that come in concert with injuries to the elbow. Some of these injuries can actually cause permanent damage to the elbow where even throwing a wiffle ball in the backyard 20 or 30 years later won't be possible.
Since there was little scientific evidence to pinpoint the forces at work in a young pitcher's arm when the baseball is thrown, Dr. Nissen, with the help of CCMC's Center for Motion Analysis, conducted a study of young pitchers.
One of the unique attributes of Elite Sports Medicine and the Center for Motion Analysis is that we are housed in the same facility. We have interrelationship between the clinicians and the scientists that is very tight and very close. We've been able to come up with not only a protocol for evaluating pitchers' form, but also the actual stress that they place on their body from their toe to their fingertips, trying to understand where the potential risks for injury exist.
The center had to modify its equipment and software that usually studies walking problems in children to conduct the Little League Elbow study. Motion sensors attached to the body are tracked by a dozen cameras that translate the results into digital images of a skeleton that can be viewed in 3 dimensions. The biomechanical stresses at the elbow are computed over the entire pitching motion. The data collected allows the pitching motion to be studied from any angle, revealing the complex series of movements that are too quick to be seen with the naked eye.
The variability in their motion is great. What that really means to us is that the younger you are, the more likely you are to not be in a groove, to not have a very reproducible, consistent method of pitching. When you don't have a consistent method of pitching, or when you're not in good shape or in good condition for pitching, the risk of injury goes up.
There are many myths as to why injuries to the young pitcher are on the rise. Some say throwing breaking balls too early in your pitching career is the problem, when in fact, the Little League Elbow study has shown the fastball puts more stress on the young pitcher's arm.
So the type of pitch you throw, scientifically speaking, is not the cause of the injury to the elbow and the shoulder. And the main cause that appears to be relevant right now is the number of pitches you throw each year.
The information gathered by Elite Sports Medicine and the Center for Motion Analysis can help young pitchers prevent injuries.
Most of the things that we do to reduce injury are simple things.
In the off-season, take the time to prepare. Work on your overall body strength and assure that your flexibility is as good as it can be.
Good strength in your core puts you in a better athletic position to deliver a ball, deliver a pitch, and minimize the amount of injury or the amount of stress and pressure that you're putting on your shoulder, your elbow, or various joints.
The shoulder blade exercises are perhaps the most important single group of exercises in a single group of muscles that need to be strengthened in order to have a pitcher reduce their overall risk of injury.
Once you're in decent shape, work on your pitching motion.
Let's worry about your mechanics and those types of things as opposed to how fast or how hard you have to throw throw the baseball to have some success. Make sure we get our hand on the baseball the right way as a youngster and throw the ball properly. The easiest way to throw different pitches is just to use the same mechanics, change the grip a little bit.
When the season rolls around, don't forget the little things.
Jog around the outside of the field, do sit-ups or push-ups. Just get your blood pressure up a little bit, get your heart rate going a little bit before you actually touch a ball. Young pitchers who feel fatigued or tired should not be asked to continue to pitch. Pitching when you're tired has been shown to dramatically increase serious injuries. Parents can actually help their children when they pitch by making sure that they don't pitch too much. Parents, for instance, should insist that their child not pitch year-round. It's been clearly shown that if you pitch more than 8 months out of the year on a competitive basis, your chance for serious injury goes up 5-fold.
Reducing injuries in young pitchers comes down to a few simple steps, but it's up to parents, coaches, and players to do it. To find out more about the Little League Elbow Study and the Baseball Pitchers Training Program, contact Elite Sports Medicine at 860-284-0220. CCMC. Kids are great. We just make them better.